I'm Dr. Yalda Safai, and this is Freud and Felons, where we dissect the anatomy of devious human behavior. Today, I'm joined by a fellow psychiatrist, a colleague of mine, who went through a few tumultuous years as a result of a traumatic brain injury and alcohol abuse. So we're going to discuss how a brain injury and alcohol abuse can go hand in hand to creating a recipe for disaster. Join me. Today, we're joined by my fellow psychiatrist, Dr. Hisbay Ali. Welcome, Dr. Ali. Thank you for joining us.
Hi, Yalda. It's good to see you again. It's been ages. Thanks for having me.
I know it has been ages. So I know Dr. Ali through medical school. We went to the same medical school. He was a few years ahead of me. He completed his training, and as he was done, I was getting into training. So we're both psychiatrists now, and Dr. Ali is joining us because he's had a few tumultuous years, all starting with a traumatic brain injury that he's here to talk about. And I previously did a full episode on traumatic brain injuries and CTE, chronic traumatic encephalopathy, and how it affects, a lot of NFL players, a lot of inmates, and the implications of such. So Dr. Ali, or Hisbay, as we like to call him, will like to talk about his own experience. So can you let us know a little bit about what happened? When was the first time that you encountered a brain injury?
Yeah, unfortunately, I've had a couple brain injuries. Luckily, I've survived both of them. And the main one, which I think you're referring to, is a pretty bad brain injury that led to a craniotomy that happened in August of 2012. And I just started my third year residency, actually, so my outpatient PGY3. And it was on the weekend. I was hanging out with my buddy Carl, who is now a wonderful child and adolescent psychiatrist.
Nice.
And I was actually hanging out with him at his house, and we'd gone out. I think it was Saturday night, from what I remember, and just went out drinking, hanging out at the bar in Queens, New York. And got into an argument with someone. Later, I found out this guy was actually a felon. I know that's kind of appropriate because it's your podcast show. He was actually a felon. He was actually on parole, and he shouldn't even have been at the bar. This is what I found out later with the police investigation. My memory about the exact nature of the incident obviously is a little bit hazy because, I got TBI as a result of getting punched. But what ended up happening was, long story short, it was an argument over a girl, and I don't remember exactly how it ended, but it ended with him punching me, basically, is how it ended. I fell back and I cracked my skull. This was just outside the place. This was when my friend had been. So what he did, he punched me right, boom, in the face.
Oh, wow. Okay.
The punch itself actually wasn't as bad. It was me stumbling over, falling back and hitting my head on the street, on the asphalt.
So you basically got hit from the front and the back.
Yeah. Yep.
Okay.
Counter coup type injury. I think you've talked about those, right? So I had that twice happened twice in a way.
Oh my goodness.
From the punch and then from when I hit the street. So I fell back, hit the street. That was it. Just one punch. It wasn't like some crazy fight, melee or anything. It was just him throwing one punch, me saying something to him, him punching me, falling back, cracking my skull, temporal area right here. And I guess I was lucky to be in New York City at 2 a.m. on a Saturday night, where they were able to call in. They were able to call in a brain surgeon at Jamaica Hospital, Queens, to do a craniotomy. And what they found out when I got there was I had a subdural and an epidural hematoma expanding. Luckily, there was no serious midline shift in my brain. That's when they tell you, hey, you're actually having pressure, increased intracranial pressure, right? And it's dangerous now, and it could be deadly. And I think you're aware, right? Epidural hematomas can be deadly. If they're not operated on and they're expanding, they usually are lethal. Or have severe sequelae from it. So I was really fortunate that I had a craniotomy done within a few hours. They evacuated the expanding bleeding. Again, both the subdural and epidural. And then what made it complicated was I was drinking, right? So my blood alcohol was 300 something, which is 4 times the legal limit, essentially.
Okay, yeah, that doesn't help.
No,
you got very lucky. So you had one craniotomy to drain the fluid, the blood?
I had a cranial. I remember waking up to that tube, that tube that they have, the negative pressure, forget what it's called, but that's the tube to drain out the blood. So I had that. That's what I woke up to. And I had no idea, obviously, where I was. I thought I was in a spaceship. I was going through some
The spaceship.
post-surgical, post-op delirium. I thought I was in a spaceship, and
Yeah.
I think of the year was 21 something. That's what I remember telling the nurse when she asked me. So it took me a few days. It took me a few days to kind of come to and then understand what happened. And I was out of my residency, right, so for a few months because I had to make a recovery and come back. So I was actually in. I went to follow up with the PhD neuropsychologist, Dr. Lynn Schaefer. She's fantastic. And we did some serial neuropsychological evaluations to see where I was. She had already knew some of my baseline because she knew that I was a psychiatry resident and, certain scores that I'd gotten on my USMLE and stuff. So she knew kind of my baseline intelligence level and where I am. And I definitely had some deficits. Some pretty significant deficits, I would say, with word finding, because I believe I'm actually looking at the results of my CT, my head, and I had the subdural was along the left side of my brain. So I think Dr. Schaefer believed that had affected my word finding ability.
Definitely.
Yeah.
So though that was an immediate result of the traumatic brain injury, it wasn't something that developed later on down the line. It was immediately after your injury, correct?
It was immediately after the injury and surgery, post-surgical. I went and saw her. So this happened August 12th, I want to say, 2012. And I went and saw Dr. Schaefer probably 3-4 weeks later. In those 3-4 weeks, I was in pretty bad shape. I was seriously depressed. You've known me for a while. I love playing music. I've been playing guitar my whole life since I was a kid, and I play every day. I write music.
Yeah.
But I went through a phase of almost 3 months. The first month was terrible. I had to have my friends who were in, I was in a band. They came and dragged me out of my apartment to be like, yo, we want you. we miss jamming. So, they didn't understand what I was dealing with. I didn't even understand it, even as a medical doctor, as a psychiatrist. It was really hard it's hard when you're in it, going through it to look at it, even though I'd read about TBIs and what people go through in books and seen them in the hospital. So it was a really unique experience. I'm glad that I was able to survive and live through it. My program director, Dr. Jacob Sperber, may he rest in peace, passed away, amazing psychiatrist from Columbia. And he actually helped me a lot. I used up all my sick time, all my vacation, and I actually made a full recovery, I think.
You think? That's a good point. We'll get into that, I think. When people, thank you for sharing that. I studied NFL players and how even sometimes one hard impact, not cumulative impact. People think that in order to develop dementia or chronic traumatic encephalopathy, you need years of impact one after another. But even one traumatic impact is enough to cause substantial damage. I did a few research on some NFL players, and I'm glad you mentioned depression because Tamora, New England Patriot, Aaron Hernandez, and Philip Adams were all football players who ended up suffering from traumatic brain injury. Well, these are extreme examples because they ended up killing somebody and then killing themselves. But one of the first things that they said that they started to notice about themselves was depression, changes in personality, problems with, making decisions, foggy memory, all things related to cognition. So I just wanted to ask you if, not immediately after, but throughout the years, did you struggle with anything cognitively? And do you feel like that traumatic brain injury changed your life in a way?
Wow, that is an excellent question. It's a $1 billion question. First of all, wonderful episode on the CTE. I did watch that.
Thank
you. Yes, you're right. Because I think we're thought hey, repeated traumatic injuries can lead to CTE, and they usually have the, a CTE protocol nowadays, right, where you got to rest for at least I think 10 days or 2 weeks or something around there to avoid having a re-injury during the sensitive period of your brain when it's healing. So you know more about that probably. But you're right. I had this one serious head trauma, and up until that point, I never played contact sports like football. I played basketball, but I never had any head injuries from that, and so I don't remember having anything serious in childhood or anything like that. So this was the first main event that happened, and yes, I noticed more impulsivity. As a matter of fact, as written in my report here from Dr. Schaefer 14 years ago, but it says that I had some impulsivity issues. That's a really good question because I think that I had impulsivity issues from before. I'll be honest, right? I was diagnosed with ADHD, younger. So a lot of it is tied to that. And then I did have some, I have trouble drinking alcohol. I'll be honest about that. I don't drink anymore. I'm glad. And I probably should have quit
Congrats.
drinking. Thank you. I probably should have quit drinking right after the head injury, but unfortunately I didn't. That's kind of how
You know,
it goes.
the important thing is that you stopped. A lot of people don't have the insight to realize that, it is a problem. I had this traumatic brain injury. I probably shouldn't be drinking alcohol. So
Yeah.
congratulations on quitting. And we'll get into that for a sec because it's a really important topic. But as you know that I'm a correctional psychiatrist, so I work in the jail system. And there's actually studies done on inmates and how many of them suffer from a traumatic brain injury. Because think about it, a lot of these people have had rough lives. They've lived on the streets, they got into altercations with people on the street, they drink, they use drugs, that lowers their inhibition and causes them to act out impulsively or get into fights with other people. So the number, actually, one person did a good study on this. It was a researcher by the name of Eric Shiroma. He estimates that about 60% of inmates have a history of traumatic brain injury, which is not just a statistics. This can explain a lot about why they get arrested to begin with. They could explain the impulsivity. It can explain why they can't keep up with parole requirements and get themselves rearrested. This could, they know that doing X, Y, and Z could lead to something catastrophic, but they do it anyways. And I think science has not advanced that much, and it's really hard to diagnose CTE or TBI while the person is alive, right? They need to
Yeah.
have passed away. They need to do an
Yeah.
autopsy on the brain in order to be able to determine, this person had CTE. So while the person is alive, we can't determine that. But I think it's really, really important to take traumatic brain injury into account when you're doing sentencing or when you're subjecting a person to a punishment. Because yes, they understand what they're doing is wrong, but can they control themselves? So question for you is, did you feel like you had problems? I know you said you had problems with impulse control, but do you think
Yeah.
it worsened or do you think it exacerbated because of the injury that you had?
Yeah, it definitely worsened a little bit. I eventually was able to, it took me a year, to be honest, about a year of recovery to be able to feel like, okay, I'm back. And then using a little bit more objective measures like my friends or people around me that, maybe don't know me as well, but are like, okay, yeah, like this guy's fine. But, a range of people that know me from childhood all the way to my coworkers were like, okay, yeah, you're back to what you were before the injury, or 99%, 95%. So that's how I kind of knew. But you're right. I was a little bit more impulsive, but I think it was offset by the depression because I was so depressed that I couldn't get out of bed. I didn't want to do anything for over a month. And that's not me. I'm a pretty happy-go-lucky guy. You know me
Yeah.
from medical school days. I've never had any serious clinical depression where for 2 or more weeks I'm sitting in bed and don't want to eat or drink or do anything. That's never happened to me before. That only happened after the TBI. And so I think that kind of canceled any impulsivity because I just wasn't doing anything. I didn't feel like doing
Right.
anything. But once the depression kind of started getting, so I did get treatment for depression. I was on an antidepressant, which, again, I'm not a big fan of pushing antidepressants for no reason, but this was a legitimate reason. Like I wasn't able to take care of myself or do anything, really. So, even like didn't want to eat. So that was a serious depression, and
Serious,
the
yeah.
antidepressant helped me. I got through it. I was on that for almost like 8 or 9 months. They say you want to be on it for a year, just because there's a risk of if you get off of it, depression comes back. It doesn't work that great anymore. So there's always that risk. So I stayed on it for 8 or 9 months, and then when I weaned myself off of it. Again, this was under the supervision of my family care doctor,
Right.
and so weaned off of it. And then I did notice a little dip in concentration and impulsivity issues. If I do a rating scale, again, my baseline is I'm a little bit impulsive anyway. So everyone has to kind of take that with a grain of salt because I have ADD, and then on top of that, I had a drinking issue, so that never helps. But I was probably 80 or 90% after a year of control over my impulsivity back to my baseline, that is. So it took about a year, but I was able to get back to my residency. I was supervised, I was monitored. I went through serial neuropsychological evaluations to be clear to get back to being a doctor. And then after that, I had no issues in terms of I took my board exams. I passed all my regular, general psychiatry, and then my subspecialty first attempt. I didn't need any aid or anything or any special time or anything like that. So in terms of, that area of my cognition, I think I made a full recovery. But in terms of like processing emotional stuff, impulsivity, that's $1 billion question that is still in the process of being answered, I guess.
Yeah.
But
I
I
guess we
agree
could
with
never
you.
answer it fully. Yeah.
Yeah, I agree with you. I think they should do neuropsychological evaluations or have them more readily. They're kind of cumbersome, as you know. They can be a couple days long and testing multiple facets of your cognition. But I agree with you. There's a lot of TBIs that happen. You know the statistics of the TBIs probably. And you're right. A lot of them go undetected or they don't follow up. I mean, look, I never really followed up, to be honest, with my TBI other than Dr. Schaefer doing the neuropsych. I only went one time for to get my staples removed. I had 70 or 72 staples. You know, that question mark
Yeah.
shaped ones.
Wow. Yeah.
So I had to go back to get those removed, and then I never followed up with a neurosurgeon or anything like that because I'm a bad patient.
Oh, you're a doctor too. Doctors make the worst patients. But I'm glad
Exactly.
you mentioned depression because actually subtle
Yeah.
changes in mood is the first sign of something like CTE, which is chronic
Yeah.
traumatic brain injury, or even TBI. So depression is one of the first symptoms. Did you realize as a doctor that this is what is happening to you, or were you just confused?
I realized it was happening to me it took me almost like a week, I would say, just to process like what happened, right? Like what happened? How did me hanging out with my friend, doing some karaoke, talking to some girls, all of a sudden lead to me waking up in the hospital with the
Yeah.
tube hanging out of my skull, right? So that took me almost a week to kind of process. I was on heavy doses of opiate medications, which thankfully that was never my drug of choice, right? I never did like, street drugs or opiates, but I could see people getting addicted to opiates
Right.
because of that too. But I was only on opiates for less than a week. Even the surgeon and the doctors were like, you actually probably need the opiates. You just had brain surgery, craniotomy.
Yeah.
But I was like, no, I'll take the Tylenol. So it took me like a week just to kind of get out of a fog of post-surgical and then also the medications.
Do you think that incident changed your life
Yes.
or affected your life? Okay, how so?
First of all, it would be pretty ignorant and dumb for me to say, no, it didn't affect my life at all. All right. Like it did. It changed. It affected my life, whether I knew it at the time or not. That's at the time I didn't realize it, and I just went ahead. After a few months of kind of getting back on track, getting back in residency, I just went ahead like nothing happened. Once I
Yeah.
started getting back, I played my guitar. I was still playing in my band. I was still drinking, and on the weekends, on my days off, and hanging out and partying. So it didn't really change my life at that time. But over the years, now that I look back at it, yeah. Well, obviously, like I said, the first year, I was slower. My processing speed was slower. My emotional regulation was affected. I could tell all of that. Now, that was mitigated by me being on antidepressants because that helped me with my mood. And like you said, depression can lead to a lot of mood dysregulation, irritability, things like that. So I think that helped with that. So it's kind of hard to tease out, right? Like all the variables that were going on in my life. There's like if the ADD, there's the drinking, there's the traumatic brain injuries. It's kind of tease out all of them. But I was able to, over years, after a few years, realize like, okay, alcohol is bad. That led to my TBI. I would have walked away
Good
from
job.
I would have walked away from that situation because I'm not a fighter. Like I don't start fights. I've never thrown a punch in my life at anyone or hit anyone.
Yeah.
That's not,
Yeah.
I've copped a few blows. But alcohol, that's what I learned from it all was like, yeah, I don't need to add another poison to my body. And that led directly to the TBI.
Did you drink more heavily after that incident, or how did your drinking habits change after that?
No, I don't think I drank more heavily after that. I think I just kept pace with what my drinking habits were, which is I never drank liquor, so that kind of was a saving grace, if you want to call it that. Is I only drink beer, so Bud Light or things like that. So I would say it went back to being the same after like 6 months. I didn't drink for a few months just because I was depressed, right? That was the main reason. And I was never the kind of person that drank because I was depressed. I always just drank because I'm having a good time, social drinking. So I just went back to doing that. But again, I would say I was probably a functioning alcoholic. I mean, I would say that has to be the case. And so, as you know, with alcohol, people that struggle with alcohol, it just gets worse with time, regardless of the TBA or not.
You say functional alcoholic. Can you expand on that a little bit?
I know that's a funny term to throw around, right? Well, I mean, I finished my residency, I did a fellowship, I passed my boards exams, flying colors and everything. So I guess I was able to function with my professional life, and it didn't affect my professional life So that's how I would use the term, that like it wasn't like I was getting fired from work or showing up hungover or drunk at work. You know what I mean? Like it was literally binge drinking on the weekends when I was off.
Did it affect your social life?
It affected my social life, absolutely. It affected my relationship with my ex, which I do have to admit, that was a toxic codependent relationship that I was in with my ex. And the only way for me to get sober was to, unfortunately have to go through a breakup. And that's actually how I got sober, because I was just in a maladaptive relationship as well. That was another confounding variable in my life at the time.
So you think it was because of the stressor you had in your relationship, you were drinking more, or how?
Yeah, it's kind of like the chicken and the egg
Right.
kind of situation. Right. I think I was stressed out from being in the relationship. I didn't really want to be in that relationship. I didn't know how to confront her or address it, so I turned to drinking a lot to escape having to deal with that. And so it was all kind of tied in together. So this journey's been 13 years and change, right, since my brain injury, and I'm now seeing how all of this is kind of tied in. The TBI did not help. It made things a little bit worse, and I think it took me a year or two to get over that. But I made a full recovery, so I don't want to blame the TBI necessarily for everything. I think the alcohol was actually the bigger culprit, if you ask me.
So I'm a big fan of not drinking. I haven't drank in 2 years. For me personally, it was more of first of all, alcohol is just not good for you. It has the strongest link to 7 different types of cancers. We all know that. It makes you overeat. It messes up your sleep. And that was the biggest thing for me. Even one glass of wine and I couldn't sleep that night. I mean, I could sleep, but then I would wake up in the middle of the night. So for me, the risks associated with drinking were outweighing the benefits. And as a doctor, you always have to balance the risks versus the benefits of something before you choose to do it. So I decided, this is an unnecessary thing in my life. And the weight gain, as I mentioned, it makes you overeat. It makes you eat things that you normally wouldn't eat. So for me, it was like, this is not adding to my life anymore. So I stopped it 2 years ago. And it's the best decision I ever made. I feel like it's really not a necessary thing. And I always say, if anybody feels like they need alcohol for whatever reason in a social setting, I think there's an underlying issue there. What's the why? Do you have social anxiety? Do you feel like, you need to drink in order to be able to communicate with people? Do you have to drink at the end of a stressful day? Do you drink because you're sad? Like, figure out the why. If you're dependent on alcohol, the why, and address the why. For you, was there a why, or was it just for fun?
Yeah, no, there's always a why. When I say fun, I mean it was a lubricant, like a social lubricant, right? So I had a lot of social anxiety as a kid, and I can kind of give you a little brief synopsis of what led to that. And that was because my parents went through a pretty crazy divorce when I was a teenager, and I lived in Pakistan for 5 years when I was from 10 years old to 15 years old. My dad moved us all back there. So kind of like reverse, I born and raised here in America. Then I went and lived in a third world country from 1991 to 96, 7. And so, I think a lot of it was coming back and adjusting to the culture in America. Then I went from that to going to school in Laguna Niguel in California in the late 90s. So that's a big culture shock for a teenager. And then I started college at 16. I started medical school at 20. I was the youngest kid in my college, in my class, and in my medical school. So, I just was behind the 8 ball socially, and I lived a weird kind of life up until that point anyway. So being able to be relaxed around people and enjoy their company and not being like tense and anxious all the time. I didn't even start drinking until I was in medical school. So it's not like I was drinking in high school and college. I was the designated driver taking everyone around. So medical school is where I started drinking, just to be able to relax and enjoy and hang out. And then unfortunately, it went from there to drinking more than just a few drinks. But luckily, I never was the kind of person. The one thing that saved me was I never was like, hey, waking up every morning, got to drink. I think me being in medical school, having to do that, and then also enjoying playing guitar and writing music, that saved me in a lot of ways. And having good friends, of course, good friends, and to kind of be like, oh, hey, we'll do something healthy. That saved me, but it still wasn't healthy because it went from being like, hey, drinking once in a while, maybe a couple times a month, to every weekend. Just to hang out, and it became associated with socializing. And then being a musician, it's part of getting up on stage and playing guitar, right? It's like a lot of social anxiety, performance anxiety. It was tied to that. So I stopped drinking it's going to be almost 2 years. So first of all, I want to say congrats to you. 2 years is really
Thanks.
good. And and I can't wait to get to 2 years. And I don't want to drink again. I noticed the improvement I've had in my guitar playing, but it took me
Yeah.
it took me almost 6 months to get to that level. I joined a sober musicians group to get my confidence back, because
Oh, nice.
for 20 years I've been playing guitar with drinking beer involved. So you kind of have to relearn it. I read a bunch of books by musicians like Eric Clapton who got sober and like how to regain that confidence. So that kind of helped me as well. But you're right, alcohol is the worst. I think people think that like even 1 or 2 drinks is healthy for you, but now the studies show that no amount of alcohol is good for you in the long run.
It's not. What was the trigger for you that you're like, okay, I'm going to put it aside? Was it a certain age, a certain incident? Was it like, what was it that flipped the switch for you?
There's a culmination of a few things, I got to say. I've had a colorful life and a colorful past. I've been arrested a number of times for minor stuff, nothing, number 11 altogether, if you really want to put a number to it, over the years. But they're all dumb stuff.
Before we get into it, do you think the 11 times that you were arrested were your poor judgments, I want to say, or was it other factors such as alcohol or just having that injury that were a factor?
Alcohol, definitely. I don't think I ever got arrested. No, I've been arrested once or twice sober. A couple times it was mistaken, like whatever. But alcohol, mouthing off to police officers. So probably a few of those arrests were unnecessary. It was just because me being disinhibited and mouthing off to the police officers led to them arresting
So
me.
you were never violence, as you said. It was just like
No.
verbal altercations.
But yeah, alcohol played a huge part in that. So, I probably should have given up drinking after arrest number 4 or 5, but unfortunately it took
Yeah.
10
Did you have the
10 plus.
insight, though, after arrest number 4 that, okay, you have a problem with alcohol, or did the insight come much later?
I had insight, but I'm a rebel, like oppositional by nature. I come from a family of overachievers. My mom's a doctor. My dad's a PhD chemical engineer. I have 2 sisters. They're both surgeons. One went to Duke. She's a vascular
Wow.
surgeon, works for the VA. My other sister is colorectal surgeon. I'm kind of a rebel, like against my parents. I think a lot of it had to do with my dad because he was kind of an overbearing father, and my parents went through a divorce. So a lot of my drinking, I can tie it to that rebellious behavior.
To unsolved trauma, or what exactly?
Problems with authority.
Okay, so that would explain the police officer. So when you see like someone in an authority
Yeah.
figure kind of
Yeah.
role, does it trigger something for you, or what do you mean exactly?
I thought I could get away with bending the rules. That kind of oppositionality that goes also hand in hand with ADD, by the way, right? Like ADD,
Yeah.
untreated ADD, you're kind of you're impulsive anyways, and then you have issues with authority and people trying to put you in a box and trying to tell you to follow certain rules. That you throw alcohol in the mix, and of course, like I had kind of a
Yeah.
disregard for again, I'm not saying like I broke the law and rules, but like I kind of didn't pay that much attention to them. I want to say that's again part of ADD and. Substance use thrown in the mix. As you know, I think there's like a 70 or 80% comorbidity, right, with ADD and
Exactly.
substance use. So
Yeah.
that was kind of a lot of it. It took tying this all together. It took me many years, a journey of many years for me to look back and be like, wow, I was really doing a lot of dumb things, making a lot of impulsive decisions. Not at work. Like again, at work I could put on a different hat, but this is my own personal life. I think when you leave work, a lot of times, just because you're a doctor doesn't really mean that you're going to take care of yourself. You can
Right,
take care
exactly.
of patients. You can
You're
take care of
human. We're
patients.
human. Yeah.
So when I get home, I thought I was invincible.
So it's something it really bothers me because a lot of doctors, I don't know the statistics, suffer from alcohol abuse, they suffer from depression. Until very recently in state licensing applications, they would ask you if you've ever been prescribed an antidepressant. They would ask you if you've ever struggled or gotten treatment for alcohol use disorder, which I mean, the reason it bugs me is because when you put those questions in a medical licensing application, it deters people from wanting to get treatment. They don't want to have to answer yes to that. Have you ever been prescribed an antidepressant or a
Yeah.
psychotropic, or have you ever gotten treatment? So they don't do it. They suffer. And I mean, I've seen this with a lot of doctors. They just don't ever get treatment for their depression until it's too late. They don't get treatment for their alcohol use until it's too late. So it's really unfortunate. I mean, doctors are humans too. They suffer from all the, psychological problems that regular people do. So there
Yeah.
has to be like a safety net. It has to be a supportive environment that they can go go to for help. Did you ever at any point get that from like your superiors at work or like the medical community as a whole?
Wow, another great question. So at work, going back to work, I never had any problems at work, right? Like in terms of drinking and doing something dumb because I was intoxicated or hungover. So that at least thankfully never happened.
Good.
Mine was all on the weekends, like, hey, I'm a Friday night, Saturday night, right? That was mainly my problem. Yes, when I got a DUI in New York 10 years ago or something like that, and that when my work, I reported that to my work. I didn't lie about anything to the medical
Right.
board and to the work. No, there wasn't anything in place, and I that's why I agree with you. I wish there was, I wish there was something in place to kind of like help me out or help other, again, I don't know how much of it would have like fixed me right away, right? Like it took me
Right.
a couple talking to some therapists, counselors, having good friends over the years to finally have that insight and then be motivated. Motivational interviewing, right? We employ that when we're talking to people with substance abuse issues. Like you have to be motivated. It has to come from within that you want to give up, doing drugs or drinking or eating garbage food or whatever it is the addiction is. So
Right.
that has to want to come from within. That took a while. I had a probation officer tell me, hey, stop drinking. Why don't you believe in God more? Those kinds of things, they don't work. They don't work, right?
Yeah.
You know that.
This is why a lot of people don't want to go to AA because one of the, I think the first like pillars of AA is believing in some sort of higher power. And a lot of people take that as God. And a lot of
Yeah.
people don't want to because they don't believe in God. So great point
Well,
there.
yeah, exactly. Look, I'm agnostic, and that's fine. I've been to AA meetings. I have nothing against AA. It works for people that it works for. It works great, and it's the fellowship and the that whole thing, having a sponsor and making you do a moral inventory. But you can do that in other ways. Like I went to Smart Recovery. That's actually what helped me the first 6 months to a year. I went to an outpatient thing. With my monitor for Nevada State, so I do have a monitor in Nevada State that because of the DUI and like that clicked into place. I wish there was something in place. You're right. It's an embarrassment and it's shameful for doctors to admit that they have addiction. There is still that barrier there, or any mental illness. I worked with a psychiatrist who had bipolar disorder, and he was kind of like just fired or let go, and they didn't really want to address, hey, this person has a hypomanic episode and maybe we should try to help them or send them somewhere. And then also on top of that, psychiatrist, you're a psychiatrist, so you don't think that you have a problem maybe, or you think you can get control over it yourself. That's a big hurdle too. So it's kind of a double whammy.
How many of your, if you feel comfortable answering this, how many of your 11 arrests were because of a DUI?
Out of the 11, I actually had 3. 2 were back to back. That was completely dumb. One of them was like right next door to where I lived. I think they just scanned my license plates when I was out and were like, yeah, let's like pull this guy over. And then the one that finally led to my quitting drinking was 2 years ago, 2.5 years ago. 2.5 years ago.
Was it a big one? Was it an accident or just a DUI?
I never, it was an accident where I was, I basically like hit a tree, rolled over. I didn't hurt anyone. Thankfully.
Good.
Luckily,
Yeah.
I never hurt anyone or injured anyone. Even myself, I've only had like minor like cuts and scrapes, so I'm thankful for that.
Good.
It was really stupid. If I could go back and change anything in time, any one thing, it would be drinking. It's the best thing to come out of it. Honestly, the last couple of years, all the mayhem, the best thing to come out of it was I gave up drinking. Best decision I ever made in my life. I'm with you on
Yeah.
that, and wish I'd made it sooner. But hey, we're still young, and we can still, we got a lot of
Exactly.
life ahead to enjoy. Sober.
It's never too late. Yeah.
No.
Out of the 11 arrests, how many of them were not DUIs but were alcohol related?
Kind of like giving you a brief synopsis of the 11 arrests. One of them was I was driving underage as a 13-year-old in Pakistan. And they
In
arrested me on
Pakistan,
show me-
really?
In Pakistan, that doesn't count. Another one was in a Caribbean island for some dumb stuff like smoking some pot, on a weekend. That was in the island of St. Vincent. I spent a weekend in jail there. Alcohol being involved out of the 11, there was no alcohol in 4 or 5. I actually got one arrest for just not having a sober link or intoxilog device in my car, but I actually had it in my car and I had completed it, but it just wasn't updated, the TMV, so I got arrested for that sober. So I'd say
So-
alcohol was probably involved in like easily 5 or 6 out of all the arrests. Again, like I said, at one time I got arrested in Arkansas. I was on vacation with my ex. And I was watching a basketball game and got into an argument with someone and then got arrested, for public intoxication. So that was one of them
Wow.
too. So dumb
Yeah.
stuff like that, where the cops, half of them, the cops didn't even really want to arrest me, but I like forced their hand by just being an idiot and intoxicated and, disinhibited. So I'm embarrassed about that, obviously, but I'm talking about it now
You live
because I
and
hope
learn. Yeah.
it helps. Me talking about it's helping me like process, hey, wow, like I'm glad I'm not living that life anymore, and also maybe help some other physician or resident struggling with addiction. I'm in a sober group with the professional monitoring program here in Nevada State, and it's actually really good. Every week check in, there's lawyers, doctors, pharmacists, judges, even there's a couple, judges there. So there is some kind of like a group that's there for professionals to help them. But it's not really well known or well publicized in the medical field. It's kind of something that you don't want to talk about. You brought up a very important thing about alcohol abuse, just using that word, right? Like when we first started the interview and I was like, hey, should I say I'm an alcoholic or do I have an alcohol use issue? Because even just using, those are explosive terms, right? You get denied certain insurances and you get denied certain things if they find out, hey, you have an alcohol problem, right? So I'm with you on that 100%. I think that's very prohibitive. They should make it more confidential where it's like, if you reported this for sure is not going to come back to you, but we'd rather, in the interest of harm reduction, right? We'd rather you come and be honest and tell us, hey, if you're a doctor, okay, then you might have to do some monitoring thing, and we'll make sure we follow up. But, kind of making it still kind of like, not everyone else has to know, but we have someone on your side and we want you to be successful as a physician and you suffer from an illness. Just like diabetes.
Did any of your employers, because I'm going to tell you a little backstory. I had an ex-boyfriend who unfortunately suffered from depression and alcohol abuse. He ended up getting fired from his job, didn't seem to recover, and then he ended up passing away, unfortunately. But he never had the opportunity to be like you, stand here and say, yeah, I made all the mistakes and, I recovered and I'm moving forward. And I wondered, I don't know what exactly were the details of his case. He was fired from his place of employment. So I'm wondering if your employers, any of you, decided to terminate you solely because you were struggling. And he lost his medical license. And I did look up the reason he lost his medical license, and it said alcohol abuse and untreated depression. It actually said that as a reason for losing his medical license. Did you face something similar or no?
Let me tell you something about these agencies. I don't want to name any names because, I don't want to get anyone in trouble, or you or myself. But agencies,
you don't have to,
like when these agencies, these state agencies, they're there to obviously like to protect the public. And when they give you a medical license, like you're a real doctor, you're not some fake and phony, and that you've done all the credentials. But I don't know how much they actually care about the individual doctor and their mental health. Right. I don't know.
Yeah.
I think, I remember having this conversation with a psychologist, and because I was going through stuff with the medical board. One of the things the medical board had with me, too, is that I didn't report the DUI in time in an appropriate manner. OK, I accept that. I'm not arguing that point. I accept that. But, this guy told me, he's like, yeah, the medical board. Again, this is some guy's opinion, but I've heard this from a few people. And I actually have a couple friends that have worked as investigators for the medical board. So I can tell you from their opinion that the medical board makes it really prohibitive. When I got my DUI 2 years ago here in Nevada, board from another state wanted to piggyback on that and forced me to go to an inpatient rehab and spend $25,000 of my own money to go into an inpatient rehab when I'd already stopped drinking already at that point. It'd already been a few months and I was being monitored. I'm like, hey, you want to just talk to my monitor? I check in with him and I blow into a thing like a few times a day. Right? So
do you think they just did that to cover themselves? Like they just wanted to say, okay, we made him go into treatment even though you were sober at that point?
Yeah. If I had to pull out 20, you know what they told me? Pull out the money from your retirement, your 401k, because I said, hey, I don't have the money right now. Like I lost my job.
Oh my goodness.
Like,
are you serious?
My license got suspended. They're like, pull the money out of your 401k. That would make me more depressed and suicidal, right?
That's actually terrible because you're saying you're struggling. You probably lost your job at that point. You are ill. You're ill.
I lost my license. Let me tell you, the medical board, they suspended my license. Again, I'm not going to name any medical boards, but they suspended my license based off of, hey, I didn't report this from a few months ago. And because of that, they shut down the clinic. My clinic had 100 plus patients there. A few of them went to the ER because they ended up having like withdrawals from their medications that they were on, that they were legitimately prescribed by me. Does the medical board care about them? No. You know what they told them? They're like, don't you have an NP? Don't you have anyone that can cover, write them a letter? Yeah, if I write them a letter to go somewhere else, you think that's going to help and cover them in the few weeks that they don't have their meds? No, it's not.
Exactly.
And same thing with actual provider. So that's how much they care, I guess, about like the, patients. And then the provider, it's even less so, like they're not looking out for you. No one once said to me, by the way, I don't have health insurance right now. I can't even afford myself.
Oh my goodness.
Right?
Oh
like I can't even afford myself. Like,
that
hey,
hurts my heart.
I have to go talk to a psychiatrist. I can't afford it. Like to get my license back and this and that, I had to pay out of pocket a few $100s to, and that was with the discount because the psychiatrist I went and talked to knew that I was a psychiatrist, right? So, but it's prohibitive. It's prohibitive. You're right.
If you were sitting in a medical licensing board or an employer and you had someone struggling with alcohol abuse, what protocol would you put in place? How would you change the system?
Okay, that's a great question. Yeah, because I know a lot of people just, they critique and then they don't have anything to offer. And what I would say is it's a case by case. Just like how I evaluate delirium, my subspecialty is consultation liaison psychiatry or psychosomatic medicine. And when I go and evaluate delirium is a case by case basis because there's many causes for delirium. So you have to address it to the unique situation for the patient. And you can't just use a one size fits all. You start thinking that way, but then you have to kind of fine tune it. So what I would say is, hey, let's try to get to know this physician. There's not that many physicians out there, right? So it's not like we're going to go out there and be like overwhelmed.
Right.
But there's like, hey, let's find out the backstory of this physician. If it's something that's causing imminent danger to other patients, then yeah, we should probably put something in place. If this doctor is doing surgeries on patients while he's intoxicated, that's a problem. Right. So I think you got to evaluate what is the harm in, okay, like in my case, this doctor didn't report a DUI. The DUI happened on a weekend, had nothing to do with work. Why are we going to suspend his medical license and affect 100 other patients, 100 plus people's lives?
Yeah.
You know what I mean? It's kind of a case by case basis. So what I would put in place is, hey, follow the professional monitoring program. You might get a random drug tested or at work or whatever. If you mess up and you have relapses, it's okay. It's part of the journey. We're here to help you. We don't want to promote you going out and doing stuff, but we need you to feel safe that you can come and be open and honest. And then we can also help you in case something happens. I still have people sometimes call the medical board, even though I'm not practicing, right, to complain, to be like, hey, Dr. Ali, we saw him out at a bar drinking, even though I don't drink.
Are you serious? A patient will report you that you were at a bar drinking?
Not patients, people.
Okay.
People.
Yeah, people. Oh,
People.
wow. Okay, interesting. One other thing and this is what I have personally struggled with, when I was trying to get disability insurance as a physician, they run a script check. If you've been prescribed an antidepressant, you are excluded from coverage from any sort of psychiatric disability. Now, Why do I think that's a problem? Again, it prevents people from getting treatment when they need treatment. What do you think about that?
Oh, yeah, excellent question. So when I had my outpatient practice, I had people coming in from the armed forces, and they were like, hey, we can't disclose this. So we have a similar problem. Doctors have a similar problem with people that are in the armed forces. I had a judge, I had a couple of lawyers come and see me. They don't want to disclose that to their agencies because they suffer from depression. And they're like, if we disclose that we're on an antidepressant, we could lose our benefits. We could lose our, stuff. So yeah, I'm totally in agreement with you.
I don't get it.
I don't get it either. And there's still a gap in mental health, acknowledging, these people need mental health. We can't just hold people to a different standard, be like, oh, you had one episode of depression because you lost your dog and your ex did this or that. Sorry, you can't get antidepressants for it. Again, I don't suffer from endogenous depression. I'm 44 years old, so I've never had any serious episodes up until this point, other than when I had a TBI and I needed antidepressants to get me back to a functioning person, back to my residency, because my resident mates were picking up all the slack and they hated me at that point. I'm kidding. They're really supportive. And I'm thankful for them helping me out. But that helped me get back my life back. Without the antidepressant, that process would have taken maybe longer.
Yeah, I'm so glad you mentioned that. Because if you have cancer and you go through chemo, it's all okay. You come back to work and nobody looks at you funny. You don't get denied disability insurance. None of that happens to you. But if you get prescribed an antidepressant, especially if you're a professional, like a pilot, like an airline pilot or
Yeah.
some other, yeah, and you're done. You're in so much trouble. So we still like all of that stuff makes me believe we still don't treat mental illness as we do physical illness, and there's still a massive stigma attached to it. And I
Yeah.
just, I hope going forward things will change because we're losing good doctors because they can't get the care they need because they're too fearful. So creating a
Yeah.
safe environment for people to go will be key here.
Well, Yalta, people like you and maybe me are going to hopefully change that, I think, right?
Change
Like
things, yeah.
we have to talk about these things because, I think the change is going to come from people like, us in the community, raising awareness for it and helping legislation, hopefully.
Exactly. Exactly. So if you go looking back, what was one thing you would have done differently to prevent the 11 arrests? Would it be alcohol or would it be something else?
Yes, I would be a few things. It would be alcohol. Obviously I wish I never had alcohol at all, but being realistic, I wish I'd given it up sooner. Because what I realized in the almost 2 years that I've been sober is that, I'm a nicer person when I don't drink, and my friends
Oh,
like me
you're a
better.
nicer person.
My
Yeah.
friends like me better,
Yeah.
and I play better guitar. Even my guitar teacher, because I recently learned how to read music. I've been playing guitar for almost 30 years, but I never put my mind to learning how to read music because I've just been playing by ear. And he's like, man, you are amazing since you gave up drinking. Like you can pick up stuff and retain pieces of music a lot faster. So, just having little things like that as motivation is very important. And I wish I had someone in my life, who had kind of been in my situation. Like if I were to talk to a 30-year-old me, I wish I had someone like that, to talk to. And I don't know if I would have listened sometimes,
Yeah.
I'll end with like a little story of what my mom likes to remind me of when I was 8 years old and I didn't believe her that the electric stove was actually hot. And
You have to experience it yourself.
I'm like, oh, I'm going to touch it. I'm going to touch it. And mom's like, okay. She didn't think I was going to. She's like, okay, go for it. And I did. And I got a pretty serious burn. I still have the scar on my finger to remind me. So I'm that guy, I'm that kid that had to learn from personal experience of burning myself. And unfortunately, I had to burn myself a bunch of times before I figured out that alcohol is bad for me. Luckily, I didn't injure anyone in the process because that would have been, the rest of my life would have been, screwed.
The regrets, yeah.
And I
The
didn't hurt
regret and then
myself.
exactly. You hurt yourself or other person, or you might be like behind bars for far longer than the times that you
Oh
spent.
yeah,
So
yeah. I didn't do any serious. So I did 4 months behind bars. I'll go ahead and just tell you about that because I don't know if you were aware of that. The 2 DUIs I got in New York, again, this was over 10 years ago. They were very close together. I got a good lawyer. He was able to put them, together. But I still had to do 6 months in jail, in county jail.
how was that?
Oh, that's crazy. That's another podcast. That was crazy. But I learned more in those 4 months as a prisoner about the forensic system than any rotation I did as a medical student or a resident.
So I do work in corrections. What is one thing you would change about corrections? And I'll tell you mine, but you tell me yours first about the system.
How about the food?
Oh my gosh. Okay, something more like systematic. What I was going
Okay.
to say is a lot of people with mental illness end up breaking the law in the midst of a psychotic or manic episode,
Okay,
and they
okay,
up in
yes.
jail.
Yeah,
So
yeah.
I
So
think
saw,
that they don't belong in jail. So that's
They
my
don't. They
opinion.
don't. I saw in the 4 months I was there. I saw like at least 4 or 5 people in the cell block that I was in. That's just the cell block I was in, right? Come back, repeat. Bouncing back
Yeah.
into the system because they clearly were hypomanic. They were having trouble sleeping all night, bouncing off the walls, and I'm sitting in my jail cell being, wow, I can diagnose because I was able to see the 40 people in my cell block for 4 months straight.
Yeah,
Right?
yeah.
So I figured out who has what, who has antisocial personality, who
Yeah.
has a substance problem and just got caught up like me doing dumb stuff because of drinking or drugs, and then who's like, wow, this person actually has a mental illness. And there's definitely more than a few percent in that cell block that were just really needed medication for bipolar disorder or a psychotic break. That's
Exactly.
seriously, I saw that, and I learned more from those 4 months being a prisoner, like I said, than I did in my rotation. Because in the
Oh, I
rotations,
love that. I love that you say that because that what a better way to learn about the system than actually to be in it. I don't
yeah,
advise this. You could like get a job at a correctional facility, but
yeah,
that's a really good point, and I'm glad you're bringing this up. I just think the correctional facility is the way they do it is so broken. I feel like we just don't have enough psychiatric hospitals, psychiatric emergency rooms, psychiatric bed state hospitals, none of that. So what happens is these people and safety nets. So you arrest somebody in the midst of a psychotic episode. I see them in jail. I get them on antipsychotics. The second they're released, they stop taking it. They start doing drugs.
yeah.
They break the law again. So it becomes a cycle. You see the same inmate.
There was a couple people at least that I saw that were like suffering from catatonia.
Oh, wow.
They
Which
were
is a medical
doing,
emergency.
which is a medical emergency. And I even
Yeah.
said that to the officer. I'm like, hey, and I think the one person did end up getting to see a nurse. But if you're having like catatonia in the midst of a psychotic episode, you can't control your behavior,
Exactly.
right? You sometimes will
Exactly.
do crazy stuff or do something, uncontrolled movements. Maybe that's a side effect of a medication or from, so a lot of things, a lot of times, like, I think there need to be better training. There was also an autistic kid that got shot by the police, right? Because they were like,
Yeah.
in New York, that happened a few times. And I remember having these conversations with social workers, like, hey, maybe there should be like some social work or some kind of, agency that assists with some of these police officers. I love the police. I have friends that are police officers. I want to thank them for their service.
Same.
So this is not like one of those things where I'm knocking on them. I actually want to thank them for their service. And I think that they're sometimes put in situations that they're not trained for.
Exactly, exactly. I recorded a whole podcast episode on the deinstitutionalization movement that happened and how we took these basically mentally ill individuals from their stable living environments in state hospitals and put them on the streets and into the prison system. And this started in the 70s, and we're 2026 now, and nobody's been able to solve this problem. So someone with
Yeah.
mental illness, even drug abuse, honestly, someone who struggles with drug abuse oftentimes ends up breaking the law because they need their next fix. They need to steal to get money, to get, opioids or whatever. They're addicted, right? So
Yeah.
even those people, I feel like just arresting them, having them serve time in jail without any sort of rehabilitation is pointless. We call it corrections, but what are we really correcting?
Totally. Yeah. It's not a rehabilitation system. It's more just like, hey, punitive, let's get them off the streets.
Yeah, I agree with you. I mean, you experienced it firsthand. I treat patients in jail all the time, and all the
Yeah.
jails are the same. I've worked in different states and different correctional facilities. They all seem to struggle with the same issue. People with
Yeah.
mental illness don't belong in jail. They need treatment. They belong in a rehab. They belong in a psychiatric hospital, not in jail. So thank you for bringing that up. Is
Yeah.
there anything else you want to add about your experience, about your life, in retrospect, that is a learning point or a motivation for somebody who's going through something similar as yours?
I wish I had some mentors when I was younger, like that
Yeah.
talked to me about this. That's the best, the thing. I would love to go to my medical school or, any medical school and give talks just to be like, hey guys, you're in medical school right now. I know you went into medical school to save lives, help people. You went in with a good heart, but ethics and moral, there's a slippery slope, especially once you throw like substance in there. And
Yeah.
I want to just, this is the, ghost of, future, I'm that ghost
Yeah.
of, the future coming to warn you about what might happen to you. Like, I wish I didn't make all the mistakes that I made. But then again, like now that I'm talking about it, that's part of my personality. I guess I had to make those mistakes. I wish I made fewer of them, but
Yeah.
I would just try to give someone who's maybe teetering on the edge of like, oh, like, yeah, I should get help for this substance or whatever before it gets out of hand. So even if I gave a talk to like, one semester in med school once in a while, like, it might be able to touch someone, might be able to help someone and change the course of their life.
Yeah, I agree with you. A lot of times when you're younger and you don't have a lot of life experience, and you're not talking to anybody, how are we expecting you to heal and move on and get better when it's just you alone with your thoughts? So it's really, really important for people not to be afraid or to get treatment or some sort of help, someone they trust. It could be a teacher, it could be a friend, it could be anybody. It doesn't have to be necessarily your parent. It doesn't, just somebody that you can trust that has an objective view of what you're going through that can get you the help you need. So Thank you so much, Dr. Ali. Any questions, anything you want to add?
No, I just want to thank you, Yalda, and your team, Charlene, for doing amazing work. You guys, seriously, I think, really do help a lot of people, not just, people in the medical field, but, able to listen to you, hear mental health problems, talking about it, that affects, physicians as well. Because psychiatry gets a bad rep, as you know. The history of the
Still
field
does,
gets a
yeah.
bad. Still does, right?
It
Of like
still
trying
does,
to
yeah.
do mind control and control people and impose DSM diagnosis on people. No, we're not. We just have a language that we use to communicate a bunch of symptoms, right? And try to like make sense of it. So I want people to not be afraid of the psychiatrist. I've had to tell people like, just open up, be honest. Hopefully it's a good psychiatrist that'll help you out. And you guys do that for me and for other people. So I want to say thank you, Yalda. And
Thank you so much.
I'd love to be back on the show.
Definitely. I actually started this podcast because majority of my work is in corrections, and I wanted people to understand the psychology and the why behind the bad things people do. Because you hear about a story on the news and you're like, oh, this person's pure evil. They did X, Y, and Z. It's a lot more complicated than that. A person is not born pure evil, usually. There's a lot of factors that go into making the person what they are. Lifetime of abuse, bad childhood, substance abuse, medical illness, TBIs. In fact, some of the most famous serial killers had a history of a traumatic brain injury. One of them, which I think is like the worst serial killer who has ever lived, Richard Ramirez, he had a history of a major traumatic brain injury combined with other factors. But I think people don't realize the why behind things. Like sometimes people are just the victims of the cards they were dealt or the circumstances that they were born into. So I started this podcast for people to be able to make sense of the why behind some of the things people do. So I would love to have you back to talk about other issues related to corrections, mental illness, substance abuse, all of that. But thank you so much for joining us today and telling your story.
Thank you for having me, Yalda.
Thank you for listening. This is Freud and Felons. Please like, subscribe, and comment to appease the algorithm.